Is our signal to go, or do you still need us to?
You're good to go whenever you're ready.
Okay, calling the meeting to order then. Starting with public comment. Members of the public are welcome to speak either in person or over Zoom. Speakers are not required to identify themselves. In compliance with the Brown Act, no action or discussion will be undertaken on any item raised during the public comment period. Board members may ask for clarification, refer concerns to staff, and/or request that an item be placed on a future agenda. There will be multiple opportunities for public comment throughout this meeting. So let's start with the people who are physically here. Does anybody have public comment?
I'm putting this not on the agenda.
This is for any public comment. If you want to wait until later, you can.
Wait till later.
Wait till later.
Lots of public comment, but later.
Okay, sounds good. Anybody online who wants to do public comment now? All right, no takers for public comment this time. Approval of the agenda. Would anybody like to move to approve the agenda?
So moved.
Second. Chris and Melanie, thank you.
Okay. Does everybody, please vote on approving the agenda.
Meg, I will need your vote for approving the agenda.
Approve.
Thank you.
Also, we have Michelle as well online.
Michelle has chosen to participate today just by observing. She will not be a member, but she would like to be introduced.
Thank you.
Thank you.
Okay, any opposed to approving the agenda? Any abstains? Okay. Approval of the minutes. Ayes? Oh, no, sorry, need a motion. You can tell I don't regularly do this. Somebody move. Okay.
Motion to approve.
Second, okay. Ayes,
Aye.
okay. Anybody opposed? Anybody abstain? Okay.
Meg? Thank you.
Okay, the chair report. So did you want to do a chair report from there, or should we just go to introducing Michelle?
We can introduce Michelle. Thank you.
Okay, so we have our new board member, Michelle. Is it pronounced Famula?
Yes, it's pronounced Famula.
Okay, and would you like to introduce yourself?
Sure. You guys can hear me okay?
Yes.
It's very hard to tell. Sorry. Hello. I recently got appointed to this committee by Lucas Frericks. And let's see, what can I say? I have been on the Health Council for several years, probably about 6 years, and my term expired on the Health Council, and I was asked if I'd be interested in being on the Behavioral Health Board, and I'm happy to go ahead and do that. My background is that I am a physician, a retired physician. I worked for 35 years on the UC Davis campus, ran the Student Health Service, and while I was there, we integrated our mental health service and our medical service, and that gave me a lot more insight in understanding into mental health needs. Not too much else that I can say by way of introduction. I've lived in Yolo County for the last 45 years. I'm a resident in Davis, and I really appreciate the opportunity to serve in some capacity in terms of being a county resident who's concerned about the health and well-being of the community. So appreciate the appointment, and I look forward to learning more about what you do and how you do it. Thank you.
Okay, thank you and welcome. We're glad to have you. Okay, member announcements. Anybody have an announcement? Correspondence?
None.
Okay. So the Board of Supervisors report. I think we've got Emily here for that. Emily, are you giving the report?
I think she's muted.
Oh, does she need to be?
I thought I unmuted and I didn't. Can you hear me now? Yes?
Yes.
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 So what I was saying is Tony's likely gonna cover the things that I'm gonna mention, but there were three main things that happened at yesterday's Board of Supervisors meeting that Supervisor Frerichs wanted to make sure that we highlight. One is the 8 new staff to support residents in permanent supportive housing. He doesn't take hiring that many staff members lightly in light of our kind of dire budget, but he thinks it's really imperative that those folks have the support that they need. And then same with the Medicare billing person that was hired, staff that was hired. Also, we're leaving money on the table for that. So he's really glad that somebody's going to be working on that. And then another thing that came up at yesterday's meeting was there's $1 million reserved for housing, which is not enough to build anything. And so the Board of Supervisors asked staff to look in to see if the money can be used to improve existing housing facilities. And those are the main updates.
Do we have any questions for him? Okay, thank you very much.
You're welcome.
Okay, I think we're ready for Ian for the Yolo County Housing Authority presentation. Kathy?
How do you want to do it?
However you guys want. It's been more than 3 years since I've been to a.
Let me get my presentation
Oh,
ready
board.
really quick.
While the PowerPoint's being pulled up, thank you for doing that. Can folks online hear me okay? Is this good enough volume? Yeah, awesome. Michelle, I'll see you at League of Women Voters next Thursday. Good to see you. My name is Ian Evans. I'm the Executive Director for Yolo County Housing and the President and CEO of our nonprofit development arm, New Hope Community Development Corporation. I'm going to grab a sheet that's actually at my desk. So I was originally asked to come talk to this board about permanent supportive housing in general, and through some emails with Chair Blankenship and some of the board members, I think it kind of evolved from there to a more broad presentation and discussion for tonight. Some of the questions I think it sounds like the board wanted to have answered are things like how do folks who have behavioral health needs that are stepping down from hospitals get placed into housing? What does that care coordination look like? What happens in the homeless system of care for folks with behavioral health needs, and how do they get connected to housing? What I shared with Chair Blankenship is I think that's more so kind of, I would direct that back to Health and Human Services. That's kind of their purview and role. What I can share about is the housing continuum as I know it from Yolo County in terms of the overall continuum care for those with behavioral health. I've been at the Housing Authority for a little over 3 years now, and prior to that, I was with Health and Human Services for 8 years. I was the Adult and Aging Branch Director for a number of years, so did oversee homeless services, adult crisis, behavioral health, substance use, but things have changed since then, so I didn't feel like I was the best person to speak on some of those specific topics. So I'll walk through the presentation today. I think we have 45 minutes. I don't think my presentation will take anywhere close to that, so hopefully there's lots of time for questions and back and forth, and stop me at any time if you have clarifying questions. Next slide, please.
There's a little delay, so I'll just let you know that in advance.
So before I jump into the overall presentation, did just want to say a little bit about Yolo County Housing. We were created in 1950, so last year we celebrated our 75th anniversary as an organization. You can see the mission statement up there. I'm not going to read it in detail, and I'll talk about some of the key programs that were funded at a federal level and state level in a few minutes. And then as I mentioned, we have a nonprofit development arm, New Hope Community Development Corporation. Next slide. That was created in 1999, and it is meant to help support low-income supportive housing throughout Yolo County. For a lot of affordable housing development, you need a nonprofit development partner as part of the ownership, and so New Hope fills that role in a lot of different projects, which you'll hear more about in the presentation. And then next slide, please. We have essentially four main components of what Yolo County Housing and New Hope do in terms of our main programs. One is the migrant centers. So we operate 3 of the state's 24 seasonal migrant centers. One is in Madison, one is in Davis, and one is in Dixon. These are seasonal migrant centers that are operational typically from April to October. The last couple of years, the season has extended into November and December at all 3 centers. 232 units between those 3 centers that we operate. We own the land. The buildings are owned by the Department of Housing and Community Development, HCD at the state, and HCD pays us to operate those programs. The next 2 programs are public housing or Section 9 programs, and what folks are probably most familiar with or most often heard when having conversations with them is the Housing Choice Voucher or the Section 8 program. Those are both funded by HUD at a federal level, Department of Urban Development. And then both Yolo County Housing and New Hope are involved in affordable housing partnerships, and you'll see some of that represented as we go through the continuum here. So next slide. So as I mentioned, I think through the emails and conversations, I think that the takeaway was to try to give an overview of what does the housing continuum for behavioral health individuals in Yolo County currently look like. I had a chance to review most of these slides with most of the organizations, not all of the information with all of the organizations. So there may be, a few things that need updating or, changes that have happened in the county. So feel free to jump in and, correct me if something's off, Tony, or anybody else in the room that knows different. But I think as you look at continuum of housing, this is typically what you see. The only difference for folks with behavioral health is the addition of the residential treatment / supported living environments and permanent supportive housing. If you're talking about a housing continuum for folks that don't have mental health or substance use, you would see unhoused, emergency shelter, transitional or interim housing, and permanent housing, not permanent supportive housing, and independent living or market rate housing. Next slide. As we go through this, you'll see that the continuum is extremely complicated. And so this next slide and diagram, this is why I printed it out so I can reference it myself too, because it is very complex in terms of the partnerships and the funding that is involved. And so as we go through here, you'll see anything highlighted in red is meant to indicate where the county, primarily Health and Human Services, has provided one-time funding, typically capital funding or infrastructure funding to help with a project. Orange is where there's partial funding, so either partial capital and ongoing service support, maybe all upfront capital to purchase or rehab or develop, and then a portion of ongoing services or some combination of both. Anything highlighted in blue is meant to indicate that there was no initial capital contribution, but that ongoing service support is being provided through funding. And then green means that it was fully funded, so the county, typically Health and Human Services, like I said, fully provided the capital to build, purchase, or renovate, and provides ongoing services. And then anytime you see an asterisk there, it means that it currently has MHSA funding, and I think likely will have DHSA funding, hopefully, moving forward. And there's a few projects that are highlighted that I'll go into more detail once we get through the rest. So next slide, please. The next slide that's going to come up, so this is where we start the continuum, other than, we do know that there's folks that are unhoused that have behavioral health needs, which is why we need a housing continuum for those with behavioral health. So we don't have anything around unhoused out here. We started emergency shelter. In Davis, there's Paul's Place. There's 4 beds of emergency shelter. Paul's Place is owned and operated by Davis Community Meals and Housing. And this is indicated as red because the county, when Paul's Place was being constructed during COVID, like a lot of projects, there was cost overruns. The county and the city of Davis used American Rescue Plan funding to make sure that the project came to fruition, provided just under $1 million in capital funding to help build Paul's Place overall. In Woodland, there's the East Beamer Way Shelter, which is owned and operated by Fourth and Hope, and they have 100-bed capacity. Because of shifts in homeless funding over the last year or so, even though the facility can operate at 100 beds, they've only had staffing to support about 60 to 70 beds being full at any given time. There are 24 BHBH, which is behavioral health bridge housing units throughout Woodland. This is indicated in blue, again, to mean that no capital contribution was provided up front for those units, but ongoing funding support is supporting those units ongoing. In West Sac, the city of West Sac owns the Roadway Motel, and they use it as interim emergency shelter. It has a 40-room capacity and serves typically about 60 folks at any given time. There are 31 additional behavioral health bridge housing emergency shelter units in West Sacramento, and this is orange. So again, that's partial funding. The county, through the BHBH funding they got, provided a significant amount of initial capital contribution to purchase and renovate a couple motels over there and provide ongoing service funding to provide the support services needed there. It wasn't the full amount needed for the purchase and rehab or the ongoing services, which is why it's captured in orange there. And the same for the Flamingo Motel. And then the city of West Sac also owns and operates as emergency shelter, the Westwood Motel that has 20 rooms. And then there are a couple Empower YOLA domestic violence emergency shelters throughout the county. These are purposely not listed in any jurisdiction because they're meant to be confidential, and location is meant to be confidential.
What are the numbers for those?
The emergency shelter, the domestic violence?
Yeah.
That's a good question. I don't know. I'll check with Empower, with Selena, yeah. Thank you, Christina. So next part of the continuum, transitional or interim housing. As you can see from the slide, as far as I'm aware, and the different providers I talk to are aware, the only transitional interim housing is in Woodland. Yolo County Housing owns and operates Trinity House here in Woodland on behalf of the county. And it's indicated in green because it was MHSA funds were used to purchase that and provide the ongoing support services. Health and Human Services provides the supportive services needed. Yolo County Housing maintains the home in terms of rehab, and maintenance needs. The IGT house, that is
How many people at the Trinity House?
that's a 5-bedroom house, so typically about 5 at a time, yeah. And same with the IGT house. The IGT house is did receive county funding, but it's not through HHSA, which is why it's not color coded here. That's owned by Yolo County Housing on behalf of probation and funded through the Community Corrections Partnership. For those that are familiar with the CCP or Community Corrections Partnership here, that is interim housing for individuals on probation. Fourth and Hope, substance use recovery and transitional housing. So there is transitional housing beds for men and women. I don't know the exact number currently. At one time they had about 60 combined beds for men and women total here. Again, indicated blue, ongoing service support in terms of substance use funding coming from Health and Human Services to help support some of those beds. Cache Creek Lodge here in Woodland as well has recovery and transitional housing, no county funding coming for that. And then Haven House is a short-term medical respite care facility. It's operated by YCCC. And while there was some previous funding through funding called HHIP from the county, my understanding is that has been spent. That contract was meant to help Haven House apply for and stand up a CalAIM medical respite program, and they've done that now, so they're billing CalAIM for that moving forward. Next, we get to our residential treatment and supported living environments. So again, this is one of those aspects that you won't see in non-behavioral health housing continuums. In Davis, we have Pine Tree Gardens East and West House. Those are designated and licensed as what's called adult residential facilities. We have many experts around Pine Tree in the room here, so they'll correct me if I misspeak. The New Hope Community Development Corporation owns both of those homes on behalf of the county, which I'll speak more about later. It's highlighted, which is why we're going to talk about it later, but also the font is green, meaning that the county, through the MHSA funding, provided the capital to purchase both of those homes and provides ongoing support services to those. Farmhouse is an augmented board and care. It's in the rural part of Davis. It is, to my knowledge, there's no significant capital contribution that's come recently from the county, but they do provide MHSA funding ongoing to help with some of the support there. And then we have Walters House, which is here in Woodland. A new 60-bed Walters House facility opened last year, I believe, or very early this year, out on the East Beamer Way campus, where the 100-bed shelter also is located. And the county provides some substance use funding through the Drug Medi-Cal Organized Delivery System program for that. Cache Creek Lodge has a residential substance use treatment program here. My understanding is that probation has a current Prop 47 grant that they operate, and they're providing some funding to Cache Creek, but no other county funding. And then also operated by YCCC here in Woodland is the short-term crisis residential program called Safe Harbor. It is meant to do exactly what it says, which is to stabilize short-term crisis and get folks back into the community. It is currently receiving MHSA funding, and my understanding also is that there has not been significant, capital invested recently from the county, but there is ongoing MHSA support to that program. So now we'll shift into permanent supportive housing. And I know I'm talking really fast, so tell me to slow down or stop if you have any questions. There's a lot that could be said about permanent supportive housing, but I think these two bullets sum it up nicely and hopefully are key takeaways for folks. So it is a long-term evidence-based solution for those that experience chronic homelessness. It pairs affordable, stable housing with voluntary, comprehensive, and flexible services. You'll often hear things like whatever it takes approach or full service partnership or wraparound support. It's designed for individuals with disabilities, so it could be physical disabilities, mental or behavioral health needs. And it combines it with a rental subsidy, so a lease, and often you'll hear a lot of the projects often have project-based vouchers or vouchers from the Housing Authority to help with that rental subsidy. And it pairs that rental subsidy with on-site supportive care, which allows for long-term residency rather than temporary shelter for folks. Next slide. So this is the permanent supportive housing in Davis. Homestead is owned by an organization called CHOC. They own multiple properties throughout Yolo in different counties. YCCC provides the supportive services, and Yolo County Housing has 14 project-based vouchers on the units at Homestead. Cesar Chavez is owned by Davis Community Meals and Housing and New Hope Community Development Corporation and some other tax credit investment partners. And Davis Community Meals and Housing provides services there, and Yolo County Housing provides 10 project-based vouchers. Creekside is a fairly new development in Davis, opened a few years ago. Davis Community Meals and Housing and some other tax credit investment partners own that project, and Davis Community Meals and Housing provides the supportive services for those folks. And then Paul's Place, which was mentioned earlier, they have the 4 emergency shelter beds on their ground floor. They have transitional housing on their second floor, and the top 2 floors, they have a total of 18 permanent supportive housing units between floor 3 and 4. And 5 of those units have project-based vouchers, and Davis Community Meals and Housing provides the supportive services there. So then in Woodland, we have New Dimensions, which is owned by CHOC, and YCCC provides the supportive services to the residents there. It's actually right in the same area as Safe Harbor, so it provides good overlap and support between the 2 programs for YCCC there. Hotel Woodland here in Woodland. There are 15 what are called DASH project-based vouchers. That's a partnership with the Housing Authority and the VA. So the VA provides supportive services for veterans that have project-based vouchers that are living in those 15 units. And then a couple of our key permanent supportive housing projects. So in Woodland, we have West Beamer Place, right across the street over there. It is 80 total units in the development. Mercy Housing and New Hope own that. There are historically have been 32 permanent supportive housing units supported by the Health and Human Services, 12 of those by the CalWorks Housing Support Program or HSP program. and 20 being MHSA full-service partnership units. And those 20 units have project-based vouchers from Yolo County Housing. Those 20 MHSA units, we'll talk more about the supportive services in a few slides. East Beamer Way, the same campus that has the 100-bed shelter and the 60-bed residential substance use program, also has 60 total permanent supportive housing units on that same campus. It's owned by Friends of the Mission, and while it's 60 units total, 29 are county or county contracted support service units. 25 of those have project-based vouchers. And for both of those, you can see the asterisks indicating MHSA funding support currently. And then in West Sacramento, next slide, there is 1801 West Capitol. This is a 85 unit completely permanent supportive housing project owned by Mercy and New Hope Community Development Corporation. 41 of the 85 units are No Place Like Home FSP supported county or county contracted units. And 44 receive services from community care health centers. And then both Fourth and Hope and YCCC receive funding from what's called the Homeless Continuum of Care funding at federal level, or COC funding, to do scattered site permanent supportive housing throughout the county. So they get money to both lease up units and provide the support in those units, but they're scattered, typically master leases, at apartments or small homes. Next slide, please. So these are the projects that were highlighted on there that I know that we've talked more about. You heard Emily from Supervisor Frericks' office mention some action taken at the board yesterday, so I'll talk about that in a minute. West Beamer Place, again, right across the street, Mercy Housing and New Hope owned, county or county contracted provider is required to provide services to 20 of the units over there. And that was born out of a MHSA application through a state program called Cal HFA at the time that helped build the units and contained a 30-year service commitment clause for Health and Human Services to provide the supportive services there, or a county or Health and Human Services contracted provider that had a 30-year commitment to it and included 2 on-site support staff in part of that commitment. East Beamer Way, Friends of the Mission owned again, and the county or county contracted provider. Health and Human Services in the county were a co-applicant in what was called No Place Like Home funding. And actually before that project got built, it shifted to Home Key funding that had the same requirement and contained a 20-year supportive services commitment from the county or county contracted provider. And that included 3 on-site full-time staff. 1801 West Capitol, the one that was mentioned in West Sacramento, 85 total units, 41 are county contracted or county supported. The county was a co-applicant in the No Place Like Home application for that as well. And that included also a 20-year commitment, which included 3 on-site supports. Those, I wanted to highlight those because they're different than all the other permanent supportive housing projects because of the way that the partnerships happen and because of the funding that came with it and the commitments that came with it. So wanted to highlight that. Also knew that there was going to be a board meeting that would talk about that yesterday. And so that is what Emily from Supervisor Frericks' office was speaking about. The funding environment has shifted quite a bit since, these applications happened. The county had a contractor that I'm sure this board, likely has heard about that ended in July of last year, and the county was working to try to figure out how to backfill all that support. And this is one of those pressure points where, the funding was a struggle and the supports weren't there. And so I think all the partners are extremely grateful for Behavioral Health Director Kildare, Director Monica Morales, CEO Mike Webb, and the board for the action they took yesterday, which was to not delay any longer and immediately fund and work on hiring these positions and get them staffed so that the folks can continue to get the support they need. Because we've seen great outcomes with these projects and we want to continue to see great outcomes. The other one highlighted here was the Pine Tree Gardens East and West homes, again, adult residential facilities. So those are those supported residential homes that we own on behalf of the county in Davis. New Hope bought the East House in 2020 on behalf of the county and the West House in 2024 on behalf of the county. MHSA funds were used to purchase both of those, and they
Kathy Williams Boswell purchased Pine Tree West with her own money.
well, for the ownership that we have,
Oh, for the
MHSA,
100,000.
yeah.
Yeah.
So for the ownership that we have, Health and Human Services used MHSA funding. It is at a very discounted rate. It is true that Kathy Williams Fosdale, long history with the Williams family and mental health support, used her own money to initially purchase West House and kept it for a couple of years to make sure that it maintained this property and gave a very generous discount to the county to own it. So the funding we got to purchase the homes on behalf of the county was the MHSA funding. Thank you for the clarification. And the county also uses MHSA funding ongoing to pay North Valley Behavioral Health to provide the operational support for the residents on a regular basis there. Prior to that happening, there were very few staff between both homes that were doing the best they could to serve this population, and they needed more help. And so this contract was key to making sure that the residents get the care that they need there. And because it was used with MHSA, it came with a minimum of a 20-year deed restriction for these purposes and for this use of these homes, with up to a 99-year max term on both of them. The other home that I should have highlighted and called out in here, but is slightly different, is that Trinity House that was mentioned in Woodland. That's interim housing. That is 5 units that Yolo County Housing owns on behalf of the county. It was bought with the MHSA funding as well, so it has many of the same kind of contingencies and criteria here. Health and Human Services provides the supportive services there. And so, for us, these are key partnerships and really critical to providing the support needed to make sure that they're sustainable and that the residents living there are getting the help that they need. So know that the county is going through this huge transition, which I'm sure you guys have talked about, every single meeting, probably from MHSA to BHSA. Wanted to note that again in this presentation of what's currently getting MHSA funding and what we sincerely hope will continue to get BHSA funding as this transition happens, so we can, if nothing else, keep the continuum we have while things start to stabilize and we can look in the future to build more. So next slide is just my contact information. You all have it. I'm available by phone and email at any time, and happy to answer any questions.
You mentioned about staff being hired. So how many more new staff are going to be hired? What positions will those be replacements?
I will defer to Director Kildare on that.
So essentially, the board authorized us to hire eight behavioral health case managers that are specifically going to be assigned to be on site for the purposes of honoring these commitments. So it would be 2 across the street at West Beamer and 3 each at East Beamer and at West Avenue. So we still are going to need to go back to the board with a board item requesting budget approval or budget authority, to create the positions, but we've been given the green light by the CAO to start moving forward with the recruitment to expedite getting the staff hired.
I have one more question. What about other regional places like Reading, Westwood? What are the contracts that we have with them? How does that kind of fall into all of this?
I'll defer mostly to Tony on that. I'll say that falls out of, that's, I think, thought more as
Residential
treatment with a roof over their head that's not in Yolo County versus this housing continuum here in the county.
Okay.
So part of the so first of all, thank you for the comprehensive presentation. It's very helpful, to be perfectly honest with you, and for being kind and diplomatic. I appreciate that. It's been a tough 48 hours. What I can tell you is that the conversation around BHSA has a lot of people kind of asking a bunch of questions about housing interventions funding, right? And so that's the 30% of the allocation that the Proposition 1 designated to be used for housing, and exactly what can or can it not be used for.
You must speak louder.
It seems like Ian isn't talking any louder than me, but
He was much
every
louder.
meeting I feel like I have to yell, right?
Outside voice.
Yeah, well, this is my house. You come stand closer when I'm outside. What we are trying to pick apart is all of this stuff that the HSA is funding, right? And what way are we funding it through the HSA, right? So we can fund residential treatment programs through the HSA, which we do, but then housing intervention dollars cannot be used for residential treatment. Housing intervention dollars cannot be used for treatment services. It's specifically geared towards housing. Now we can use housing intervention dollars for rent subsidies. We can use housing intervention dollars for operating subsidies for facilities like permanent supportive housing. So for example, Pine Tree Gardens, we can use housing intervention dollars for operating subsidies for those facilities. So it's a question that came up yesterday at the board meeting about could we use housing intervention dollars for maintenance or repair? We can. We can use housing intervention dollars for that purpose, right? And so part of what we're in the process of doing is like we crosswalked over all these costs from MHSA into the plan, but we're trying to figure out exactly where some of this stuff that specifically related to housing goes to. And then beyond that, how do we set up a process, for example, if we're going to have housing partners who are requesting assistance with some much needed repairs, right, to some of the facilities. How do we do that in the way that complies with all of our procurement rules and that has equity for all of the different partners that are out there, right? And so we're kind of working through that right now. What I can anticipate, and I'll tell you, is what we're likely to do is some sort of an RFP, right? And kind of we were talking about highway. And we're still kind of figuring out what the details of that might be. So to Emily Alt's statement earlier, $1.1 million for a capital development project really isn't a lot for new construction, right? We could roll that over from year to year and do one big thing. But I don't really think that is what the community needs, and at least what I'm not hearing is what the community is asking for right now, right? What I hear the community asking for currently is a investment into existing infrastructure to make sure that we can maintain what we currently have. And so that is what I'm going to be advocating for as we move this process forward. So I don't know if that answers the question,
A follow-on question for that.
Sure.
Can that money be used to acquire property for board and cares? We have a lack of board and cares in this county. A lot of placements go out of county, and looking at a small board and care or a number of them integrated into the community would be a great way for some people to get housed.
So the housing interventions component of BHSA is 30% of the fund, of which we can use 25% for capital projects, right? So what I would need to refer back to the BHSA policy manual, right, around whether or not board and cares are an allowable type of program that we could fund, right? But I anticipate probably wouldn't be a problem as long as it's not a treatment provider. I think the question would be, again, to what extent is that a priority for Yolo County right now? And how much of a board and care could you purchase with $1 million, right? Right? And so I think those are kind of the questions right now. My understanding of the policy is that the money can be used to contribute towards existing or new developments, right? So for example, if there was a board and care. It was an allowable type of facility, and there was some sort of a plan where it was going to be used with other funding. That would be allowable, right? But I think the short answer is I'm pretty sure you could. I think the longer, more nuanced answer is I don't know how much you're going to get for $1 million, right? And I also don't know if that's really what the priority is at the moment, even though I do agree with you that we do have a shortage of board and care facilities in Yolo County, and that has resulted with us having individuals placed in other counties, most notably Sacramento County, which creates significant challenges in a lot of different areas, including Medi-Cal billing, right? So I would be all for any kind of effort we could to bring more resources into Yolo County like that. But again, I will defer to others in the community around what they think the priority should be right now.
I'll just add, for those of you that know me, you know I'm somewhat strategic, and so there may have been a reason why I said in some of my comments that Farmhouse, for example, or Safe Harbor, for example, haven't had a significant amount of capital investment recently. And that, I think that's somewhat of maybe what Tony's talking around, is that we know we've got very aging infrastructure in this community, that there's not typically other sources of funding. And so for maybe the first time in quite a long time, some of this housing intervention funding, if it can go to rehabbing Safe Harbor or Farmhouse or, you know,
So it can.
some of these facilities, right?
It can, in my opinion, is probably legally I should keep it to myself, right? But it can. I think that the question is like, what is the appropriate way to do it so we are in compliance with all of our county procurement policies. Also, this just in, board and care allowable. It's an allowable expense.
Okay.
We got fact checking happening. It's very helpful. So I mean, I think that the question is, okay, what would we do with $1.1 million, right? You know, so when we were out having a conversation recently in touring the Pine Tree Gardens facilities, my memory isn't going to be completely accurate here, but I recall that there are some existing infrastructure needs. There's in like hundreds of thousands of dollars, right?
Oh, yeah, did you want me to answer
No,
that?
I just wanted you to wait. I just wanted you to wait.
Well, actually, if I could just very quickly, one sentence, say that I think it's about, after the $300,000 grant that they just got for Pine Tree Gardens, there's about 100,000, 100, yeah. But I want to draw attention to Tony's statement that there's other homes that haven't received the attention that Pine Tree Gardens has. And so it's really important to identify what the highest priority needs are among all of the homes in the continuum of care.
And so also, you know, kind of trying to determine like how do we use those dollars to continue to support the sites as well, right? You know, so that we can use funding for operating costs, right? Which would kind of make a lot of sense to us as an agency, right? To be honest with you, because we cobble together different operating costs through different areas, right? And so like some of the DHSA funding is going at FSP or out of what was formerly CSS, right? And it would make sense for us to shift some of those costs to housing intervention, but then when we shift a lot of those costs, then how much is left for some of the other things that we need to do, like rent subsidies for individual clients, things like that, right? And so those are some of the things that we're trying to get a better handle on. Like at the last meeting I was at before, at 4 o'clock, right? You know, so we're working through some of that.
Another question. What is Yolo County's housing's role with like the Mercy Housing in West Sacramento?
So 2 parts. We have our nonprofit New Hope is a part ownership in the project. Like I mentioned, that exists largely to serve as a nonprofit development partner in these tax credit deals. So it's a part owner with the tax credit investors and Mercy Housing on the West Sac project. And then Yolo County Housing specifically, all 85 units have project-based vouchers there. So there's, I think, 5 of them are VASH vouchers, so serving veterans. 10 are what's called mainstream vouchers. So they're designated specifically for 18 to 61-year-olds that have a disability, so physical, mental health, substance use disability, and then the rest are general project-based vouchers. So we administer those vouchers. We work with Health and Human Services and Mercy Housing to make sure that they have their annual recertifications, they complete their inspections, that the payments happen, that their tenants pay their portion of the rent, et cetera.
One of the things that I saw before I retired was the FSP clients that were moved into the Mercy Housing that weren't ready for it. And there was a lot of drug use in the Mercy Housing. And these are individuals that had addiction issues, some of them before they went to the state hospital for competency restoration and all that process, who then fell back into the drug use, went into crisis, committed new crimes, and I believe got evicted and got evictions on their records. And my concern is about the evictions when someone who's an FSP client goes into crisis and then gets an eviction on their record while they're in crisis. Is there anything that can be done to remove those evictions from their record due to the crisis status they're in when that happened?
I can only speak to if for properties that we fully own and maintain and can control those regulations and the voucher side of it. So we have a lot of times, when we were working together in the mental health court, we would petition the housing authority at that time that, hey, this person has a charge on their record that maybe typically would not pass their background check, but here's the supportive program they're in. Can they get a voucher and can this happen? And as long as those wraparound supports were happening, they got the voucher and stuff. It's a good question for many reasons. One is, I think, something that I didn't mention with permanent supportive housing, and especially a project like West Capitol, which is 85 units of all permanent supportive housing serving very at-risk, chronically homeless, very significantly mentally ill and co-occurring substance use for a lot of them. Even in the best of circumstances, those projects typically take about 18 to 24 months for a property to stabilize like that. West Beamer over here, 80 total units, 32 of them were permanent supportive housing, the rest were general kind of affordable family units. That project took 18 months before we started to see stabilization. Stabilization means you're seeing evictions go down, you're seeing greater connection to services and care. Police are seeing decline in calls. And I think that's why the community heard so much from the partners involved in these three projects, because we were seeing that stabilization across the board before that whole contract ended. And then in the 9 months since, we started to see what the properties were like when they first opened again. And we want to get back to that stabilization. Mm-hmm. And we're confident that with these positions and the approval that the board approved yesterday, we'll see that. But I think there was a lot of lessons learned for that project in particular. I don't know that any of the partners would do a full 85 unit, all permanent supportive housing project with that same makeup again, because it just presents challenges. I think there likely would be more models like what we see at West Beamer or even East Beamer Way. East Beamer Way is 60 units. It is all permanent supportive housing, but they're separate, kind of smaller modular homes. There's a little bit of more privacy there than you have. It also is different bedroom sizes. And so you have just naturally a different mix when you got 2 and 3 bedrooms in there than all 1 bedrooms, which HNO and West Capitol is all 1 bedrooms. And so it's serving a different population than a lot of our other permanent supportive housing units serve. It absolutely needed to happen and needs to continue to be supported, and we need that in our continuum so that we have a place for folks that need that. And it presents some of the challenges that I mentioned.
We do have a question online from our chair, Meg. She asked, do we have any sense of the gap between the number of FSP clients who would benefit from supportive housing and the number of units currently available?
Can I come back to that? I'll answer that, and then I want to come back to something you said. So again, I hate to say, like, the short answer is, right, but the shorter answer is, that's complicated, right? What I can tell you right now is that currently we have our internal FSP program that's intended to serve 100 clients. We're currently serving 108. 57 of those clients are residing at the 3 permanent supportive housing sites. However, 84 of the 90 units are occupied. So that means that 57 of those 84 are currently receiving FSP level services, and so the others are not, for one reason or another. Either they declined to receive those services, or they've been determined to not be in need of that level of care at this moment in time. So we have 51 other individuals that we are actively serving who you could arguably say probably do need permanent supportive housing, but without knowing the specifics of each individual and what their housing situation is and how stable it is, it's hard to know. What I can tell you is that as part of completing the Behavioral Health Services Act integrated plan, we're required to report out some different data elements than in the past. And one is an estimate of the number of individuals in Yolo County who are likely to meet criteria for full service partnership services. And so we received that estimate that was compiled somehow by the California Mental Health Services Authority, and they're telling us that it's likely that there are 522 individuals in Yolo County that meet criteria for FSP services, right? So, and that's not shocking, right? I mean, from your history working in behavioral health, every county has a similar experience where there are more people that meet criteria for FSP services than they have slots available to serve yet, right? And so for Yolo County right now, we would be saying, well, there's 100 or 414 individuals likely who are out there in need of full service partnership services who are not actively receiving them. So I don't know if that kind of spells out what the gap is, but I would say that it's likely a significant number of people.
I think the piece I would add is that, and I somewhat hinted at this in just the overall presentation, but I think when we talk about permanent supportive housing, it's not just full service partnership clients, right? It's folks that need some level of support and some rental subsidy to live stably in these units. And so at 1801 West Capitol, for example, 41 of the units are FSP designated units, right? They're county supported, county contracted FSP designated units. The other 44 are still permanent supported housing units, but they're more moderate mental health and maybe moderate substance use. And so they receive their supportive services through community care health centers. All 85 units are permanent supportive housing, right? Same with East Beamer Way. 29 of the 60 units there are county supported FSP units. 31 are supported by Fourth and Hope for their supportive services. All 60 are permanent supportive housing, 29 are FSP permanent supportive housing units. And so I think it's important to know that distinction as we're having this conversation, and that question. I sit on the Homeless Continuum of Care Board, which is called the HPAC in Yolo County as well. And based on some 2025 data in what's called our Homeless Management Information System, or HMIS. So anytime someone has a contact with a homeless provider in Yolo County, they're supposed to have an assessment done. It used to be called the VICE for that. It's changing to a different assessment tool now. But they get this assessment and they get a score. And that score is meant to indicate their vulnerability and what type of housing that they need. Do they need rapid rehousing? Do they need permanent housing? Do they need permanent supportive housing? And in 2025, based on the scores that were done from that assessment in our homeless management information system, the number, I can't remember exactly, but it was around 300. I want to say 325 individuals, meaning that 325 individuals went into a provider like YCCC, like Davis Community Meals and Housing, Empower Yolo, Fourth and Hope, one of these partners in the community that did an assessment, and their score indicated that they need permanent supportive housing. And so I think when we talk about FSP and MHSA and DHSA, BHHS funding within BHSA, you know, and all those different acronyms. There's that universe of FSP is the most in need, right? That need the most wraparound care. There's still folks that have mental health issues that aren't FSP that need permanent supportive housing. It's just not at the same intensity or level. And so, you know, hasn't yet been, and we'd have to have, you know, ROIs for health and human services and all the HMIS users to do this kind of crosswalk data, but there hasn't been kind of this crosswalk study of, oh, those 325 folks who are identified, are they any of these folks that are already in permanent supportive housing, and what's that delta left, right? What's the problem we're trying to solve for still in the county?
Going back to the eviction issue, is there any way to get those evictions removed from those FSP clients who deteriorated and were in crisis when they were evicted?
We have two lawyers in the room. You're one of them. I would ask you.
That's not my expertise.
No, I mean, in all seriousness, I mean, I think that Legal Services Northern California, in partnership with some other organizations, I think maybe in partnership with the DAs for a while, they used to do like, I forget what you guys call it, but where they get some of their records expunged and stuff, expungement clinics. Does that sound right?
That's public defender.
Is that public defender? Okay.
DA is part of that, yeah.
Okay.
So,
I mean,
But
that would
that's
be
criminal history. I'm talking about the eviction, because the party that's doing the evicting, I guess, would be Yolo County Housing or one of the partners.
so, I mean, it depends on the different properties. We're not responsible for property management in any of the properties there. That's done through Mercy Housing Property Management Company. So that would be like a Mercy Housing Property Management piece. What I will say is that the partners we work with in here understand housing first, understand what that eviction means. And so they do everything possible. A lot of times you may hear this person is no longer on the property because of these issues, which typically would be an eviction. And that meant that we, even though they had significant mental health issues, we worked with them to leave before that eviction was actually completely processed. And we do the same thing in our Yolo County housing, like our public housing. We have all the time where we get all the way to court, and it's going to be the final court hearing, and we mediate and decide, hey, we'll give you 30 days if you get out. We don't want to get an eviction on your record either, right? But to answer your specific question, I don't know, we have to get into that further.
So I would like to go back to something that you said in the original question, and honestly, it was part of the reason that I suggested that Ian come here, right? Is when you said some people that have been placed at this site were not ready, right? And the philosophy of the permanent supportive housing sites is really housing first, right? Mm-hmm. And so that they're and what I want to have is not to take a stance one way or the other, but to have a transparent conversation about the philosophy of that model and to what extent it's working or not working, what would be necessary to make it work, right? So the idea really is that no one is supposed to be ready, right? That if they're willing to come and receive housing, that they can come and receive housing, right? And the in theory, it's like you just wrap around all this support around the individual to help them stabilize, and then they get better over time, right? In practice, it's not always that easy, right? And so I think that there's like a little bit of like a kind of weighing out on one side or the other. On the one hand, there's an ethical dilemma, or just like a philosophical, ethical kind of conundrum about this is a person who is not well and who needs to be taken care of right now, right? And on the other side, it's like we're trying to maintain a community resource, right, that is fragile and that can be upended, and then the person could actually have greater, or not greater harm, but experience harm, right, by having an eviction on their record or something like that, right? And so, for whatever it's worth, that is the existing model, right? The existing model is a housing first model. And I do know that not everyone agrees with that approach, right? That it's not exactly a consensus viewpoint, right? And again, I'm reluctant to take a stance on it, but I wanted it to just be made out there, right? So that people understand that it's more challenging than just trying to maintain the property, right? We are really currently taking some individuals into these properties who are not well, actively struggling with co-occurring disorders many times with mental health and substance use disorder. And then there's a reasonable expectation that, they not be doing the types of things that would lead to an eviction quickly, right? And that is a program challenge.
But I think, I mean, Chris,
My concern is that there is a certain number of apartments in that complex that need to be filled by FSP clients. And the previous contractor had individuals in a board and care or a room of board, and were taking them, giving them the option of moving into a nice apartment, which anyone would take over board and care. In some ways, because they had to fill those apartments with FSP clients, but also those FSP clients had co-occurring disorders, and there's a lot of drugs available in that complex, and that they were being set up for disaster. The eviction being probably the least troublesome problem they'd have when they deteriorated, committed new offenses, went back into custody, got sent to a state hospital, or eventually maybe prison. That when we're looking at how those places are managed, we're not forcing individuals, not forcing, but putting them into a situation where they're not likely to be successful. I understand the housing first, and I would say I'm probably not a proponent of it across the board because I don't think it works for everyone. I also understand that the feds, the HUD came up, a lot of programs have to be housing first to get federal funding. But I just want to try and make sure that we're not doing that so that we reduce not just evictions, but also the overall.
And I think that there's an inherent dilemma in everything you just said, right? About are we setting people up for failure? But at the same time, does the funder require this, right? And at the same time, like, is this actually the right thing to do, right?
Well, I'll say for the last several years, I'll push back on the notion that there's a lot of drugs in that complex. Even
I've been retired since 2024, so maybe it's changed, but that's what I saw.
So even talking with West Sac PD, and the police chief himself says that oftentimes what they're seeing calls of service and what's happening is in and around that complex by folks who are trying to come and access the residents there, not being necessitated or caused by the residents themselves. That's not to say that in the first, that first period of stabilization, that wasn't the case by any means. I think, yeah, I think it's a pendulum, right? And even at HUD, there's two parts of HUD that don't agree, right? The federal voucher program still has rules and regulations in place that contradict Housing First, even though Housing First came from HUD, and they're both under the same. I mean, not a surprise to anybody, I'm sure, in terms of the government, but pretty much any state funding that you want to get to build these or support these ongoing requires Housing First. And so we even have those conversations as partners involved because our vouchers have certain rules and regulations around them that the funding we got to build these units sometimes conflicts with. And I think the intention from Housing First when it was designed was, to remove those barriers, right? There were things like you had to have a birth certificate or ID or, have a money to pay for the rental application or, prove that you have been sober for X amount of time or, all these things that prevented somebody from even being able to get in. And I think what happened a lot when Housing First came out is in a lot of projects, it was stood up as housing only. And housing first will never work when it's housing only, because you are getting folks with these complex needs in with that need services. And so the service piece is key, right? You have to have those services in place. Otherwise, they're not going to be successful. The whole complex is not going to be successful, and you're going to see what.
Yeah, I guess my frustration is I saw one of those individuals in Davis having a conversation with himself on a rainy day with one sock on his foot. And all of the resources and effort to get him stable, and when placed in a situation where he wasn't going to be successful. So it's not criticism of you or your organization, it's just an observation and how we're not being successful with certain individuals in our community.
Sounds like there's another question.
That was kind of where I was going, is kind of those measures, as you're saying. I've heard you say, like, looking at that, I don't know if I to that mix again, right? That there's 18 to 24 months before we see stabilization. So I'm kind of more digging into that angle of like, yes, you're hearing that we want to stabilize what's going on, especially if it takes 18 to 24 months to stabilize and to throw something out new that it sounds like we're learning a lot right now. So I'm just hoping we can speak to that real quick.
I'll say real quick that the 18 to 24 months, I think that's not just these projects, right? That's with permanent supportive housing pretty much across the board that you see that in California, in the nation. I mean, that's just the nature of typical permanent supportive housing projects, because especially ones that are 60, 80, 100 units, because you have 60, 80, 100 folks in a multifamily complex with all those needs interacting, right? And so I don't think this is, I don't think this is what is intended by any of this conversation, but I don't want this piece of the conversation to have folks come away with like permanent supportive housing isn't helpful, or we don't want it, or because we certainly need more permanent supportive housing in Neola to help serve this population.
Is there any data that shows any, from the beginning of the house like Mercy Housing, that shows improvement over the time for that stabilization that you're talking about? Because it sounds to me like what we're talking about is setting people up for failure. And it's not going to get any better anytime soon, because my understanding is we're going to be doing away with the roadway in and moving a lot of people who have the substance use disorders and stuff too on over, either some inside Mercy Housing, but we also purchased 3 more complexes next to Mercy Housing, which will bring a lot more people over on that side. And my understanding, there's a lot of traffic that goes on in the front, not always from the people that live in that unit, but live in those units who congregate in front of that unit. So you're getting these 3 motels over here with people all centralizing over here in this area. They don't necessarily live in that housing, but are doing the things that make it difficult for the people that are trying to get clean and sober or get stable in that unit.
Yeah, no, it's a good point, and that's some of what I was hinting at before when I said, if you talk to the chief of police, he'll tell you the data shows them it's not coming from inside the building, right? It's coming from outside the building.
From the calls that we get.
Yeah.
I sit on the cab too, so
Yeah.
I hear his
So
questions that come up. I also drive a Via, and so I take a lot of clients to and from that area too.
Yeah.
So I see a lot of things that are going on, and I always thinking because I sit on here too, of what's going on. And I hear a lot of stuff from the people who live inside there about the situation that are going on inside there. So yeah, I think it's important that when we are assessing people and there's a score, and you're placing people inside there too, that to be fair, is to try to help give those people the best support for success, rather than sabotaging it by not concerning ourselves with other things that are going on that make it difficult for them.
Absolutely
I don't know
agree.
if it's something we can do.
I think that's a huge part of it, is what the board approved yesterday, which is getting those 8 positions back in place. Because that's
I like to see a score. I mean, a grade.
Yeah.
What kind of grade do we got on that?
We do track for these 3 projects in particular. We do track in collaboration with the police departments the calls for service. And so that was one of the indicators when we saw that contract end. We saw that spike starting to go back up, right?
Yeah, I would love to see success.
We track evictions, right? We track longevity, so length of stay, the average length of stay for anyone in those units. So are folks cycling in and out on a regular
successes.
basis?
And successes.
Yeah.
Where people transition out and actually get another place on their own.
Well, because this West Capitol and East Beamer Way have those FSP units and the non-FSP units, like Tony was saying, hey, we've got 90 FSP units between these 57 of them, or 86 are occupied, 57 of them are FSP clients right now. When an FSP client stabilizes to the point that they don't need medical necessity to need FSP services anymore and they step down in services, then the next unit that we fill will be an FSP unit. So we're keeping kind of that ratio, right? They transition. So
how about the contractors, the people that are contracting to run those programs that are in there? How well have they been doing because I think there's turnover on that too. In the beginning, Mercy Housing the management wasn't the best, I think. Those went out, new ones came in, and I think that's why you might see a spike.
Mercy Housing's been there the whole time. It's at that project in particular, Telecare was there in the beginning, and then it was Hope Cooperative, and then Hope Cooperative left, and now the county is taking
And now they're having more success in the stabilizations and what's going on inside there, I think, is from what I hear.
So I think we're hearing the opposite actually, right? So I mean, I'm not gonna name names with contractors, right? But that's right. When we had a contracted provider in there recently, we would get a lot of feedback from our housing partners that they were experiencing some challenges with the provider, right? That being said, when we had a provider who abruptly decided not to continue their contract, the county was like in a situation of having to absorb all these clients rather suddenly. And it was just like, it was like the perfect confluence of events, right? We were already understaffed because we were making budget cuts. We made budget cuts last year across multiple funding sources, but most notably in NHSA, where we cut $11 million out of the budget, right? We had a hiring freeze. The whole county was going through. And then right in the midst of all of that, the contractor chose not to come. And so then we were taking on all these clients. And so we just have not had the capacity to support these sites in a way that comes anywhere close to what the county committed to, right? And so I think that currently what's happening isn't really a fair assessment about what these sites could be capable of if they had the kind of support that was originally intended, right? So we're hopeful that we can fill these 8 positions quickly and get the resources out to these sites and get a better idea about how successful these sites can be, right? So I think to Ian's point, these projects were started up, there were resources in place, however well they were working, and they were starting to stabilize, and then all the resources were gone, right? And so I don't think that we've ever yet, and I'll defer to you, I don't think we've yet had a significant amount of time where everything was in place the way it should have been and running optimal. I don't think that's happened yet, right? And so that's what we're
Hi, I'm Karen Livingstone, and I'd like to make a comment about
Could you please wait until public comment?
Okay, I'm sorry.
That's fine.
I'm done.
You're done. Okay. Do we have any more questions from inside the room?
I do have one question. I have several questions, but my head's swimming right now. I guess there's 2 questions I have. Any data about clients or members who have come in and accessed the services and we've seen their score decline? And also the second one is it my understanding that these 8 positions, now that they're going to be refilled, it sounds like there's a lot of hope and expectation that they're successful, that these positions being filled are going to deliver quality metrics. What happens if they don't?
So to your first point, I think it's just kind of self-evident that we have FSP clients who come in and they meet criteria for FSP services, and then they stabilize, and then they are still residing there, and then they no longer need that level of service, right? And so that in and of itself would be evidence that people are improving, right? And so it's not everyone who is in these sites is deteriorating or decompensating, right? We do have examples of individuals who are succeeding and thriving, I think. To your other point, it will take us, first of all, it will take us some time to hire staff. It will take time to train staff, right? It will take time to orient staff to the facilities and the model and to actually to kind of get to where we need to be. And so I am hopeful that we will be able to turn the corner and make it work, right? But to your point, this is a body that assuming wants to be kept informed about the success of what we're doing, we would come back here periodically and report out. And if it was, I don't know what a reasonable amount of time, but it's like, we've been fully staffed for a year or two now, and things are still off the rails, then obviously we would have to make some changes, right? I mean, I think the idea isn't just to hire staff and then not take accountability if things don't change.
Well, I think we have those metrics in terms of evictions and failed inspections and vouchers lost and, police calls and everything for when we know it has not been working. And so, I think we can work with all the partners and the county on once we get those folks in, place, what are we seeing 6 months in, 12 months in on those metrics. And also, the average length of stay for residents, the average, are we continuing to see those FSP folks stabilize and step down? Which is actually one of the beautiful things about both of those projects, East Beaver and West Capitol. They can live in a facility and get care, stabilize to the point where they don't need that same intensity of care that they needed when they came in, and step down in services, but still stay in that same facility if they want to, still stay in that same unit if they want to. A lot of times there's challenges with either funding or programmatic restrictions and stuff that don't always necessitate that. So, and I mean, back to your piece, Chris, I think maybe that highlights like what you brought up earlier, which is, more pieces to the other continuum of care, right? Because if we have enough beds for everybody at every level of care needed, then Housing First would work by getting them into the exact level that they needed at the time and in the exact way that they, were wanting help. But it is challenging, right? Because are you gonna get someone indoors and get a roof over their head and provide that wraparound care, even if you're concerned that maybe they need a little bit higher level of care, like an augmented boarding care or something like that? Or are you going to continue to let them live outdoors and try to give that level of care, knowing that that's going to be much less helpful than getting a roof over their head and getting some support and stability? And so I think that is that philosophical conversation and that pendulum of, have we swung too far one way or the other, and is there some lessons learned and right sizing, and that I think is a state, federal, policy level conversation.
I think my personal opinion about that would be that out of pragmatism, it would be helpful for the pendulum to swing a little bit back, right? Where we try to select individuals who are more likely to succeed, right? In terms of stabilizing the program. The trade-off though is then if there are individuals that are in dire need of help that wouldn't receive it, right? And so, I mean, we're trying to weigh that out carefully. But that is sort of the dilemma we're looking at right now. I'm worried about the same things that I think that maybe you are alluding to, which is the individuals that this program would ideally be designed to make the most impact with are the least likely to succeed right now, right? And so again, we have to follow policy and regulation, what to do, we have to do, but I am worried about that, because it's gonna take a while to get things straightened out.
What's the estimate for time frame to get those 8 positions filled and trained?
Well, let me ask a couple of former county employees how long it takes to get things done.
Well, I'm just,
It's a lot different with everyone compared to how long it takes HHSA to do this stuff.
Yeah, so, I mean, what I can say is that,
Just say it.
I mean, the positive thing about speeding this up is that the board was very clear yesterday. Move forward and make it happen, right? And so that kind of clears the path for us in a lot of ways, right? So I think it's just as long as it takes us to initiate a recruitment through HR and kind of going through the process, right? I mean, there's still some stuff we have to do in the background with bringing a budget. Thank you. Basically, we have to bring items to the board to create positions, right? But like,
we also
I
have
think-
to train them too, so.
well, I mean, I think just best case scenario, 3 months, that'd be my guess, right? Any amount of time it takes to recruit, hire, have everybody go through all their background checks and do everything they need to do and kind of go through the processes and kind of be out on the sites, right? Like, that would be my best estimate, is that we'd probably be looking at some time in June or July.
Okay, we should probably wind up this
Yeah,
discussion
yeah,
now,
yeah.
but thank you very much. I mean, that was really helpful. I appreciate it. Thank you.
Thank you.
Okay, before we go to public comment, you're very welcome to comment on anything you'd like, but we do want you to know that when we get to the behavioral health director's report, we only discuss the items that we pull off. So if there's anything that you've seen in the report that you want to hear about, it would be good to mention that in your public comment. Okay, so let's start inside the room. Who wants to go first?
So you want Karen to go? Or
Oh,
should
okay.
I mean, I just have a lot of respect for Karen, so.
Okay,
Hold
sounds
on just
good
one
then.
moment. Meg has suggested,
Oh.
I'm sorry.
So we can, we can do it at the end when we do agenda planning.
Okay, thank you.
Thanks.
Okay, so Karen, are you available for public
Yes,
comment?
I am. Yes, I want to give feedback about that. See, I was one of the clients that was with Hope Cooperative Wraparound Services. And then, we got moved to the county and they told me I'd get good services. Well, I've tried to work with, it's been hit and miss having a case manager. It's been hard to access support, or even times when I try to do things myself and request help. It's just been like pulling teeth. And I just wish there wasn't the cuts so you guys could help us that moved from Hope to now the county. And it was just, I just wish that, the staff and the doctors had more time to help us and not feel like we're just some number, that we're a person. And it's hard for me. I was trying to get help with the fall and winter because I had the bad depression. Well, anyway, last week I called and got hospitalized because I was just having too much problems with my depression. And luckily I got help at a senior hall at Heritage Oaks Hospital in Sacramento. But it just kind of, at times I'm able to act, be all assertive with these people trying to get help. But other times, if you're in a bad depression, it's hard to bucket, So anyway, I just wanted to give you feedback on my experience of what's been going on.
Okay, thank you very much, Karen. It's really helpful to hear your perspective. Thank you.
Can I respond back? Is that okay?
Well, you're not really supposed
Okay,
to.
sorry.
Respond.
Okay.
Do you want to follow up with her at another time?
I was gonna suggest that. Miss Livingstone, I'm gonna request that Christina put my contact information in the chat so that we can connect and talk about this a little bit more if you're open to it.
Okay,
Thank you.
welcome.
Karen's the best. Thanks, Tony.
Huh?
She's amazing.
Yeah. You know, we're not supposed to do this, but Ms. Livingstone, I do want you to know, I'm the behavioral health director, and I do want you to know that I regret that that's been your experience, and that, you know, the staff really do care about our clients. We don't see anybody as being just a number, but I can understand that why it might feel that way based on your experience, and I just want to apologize that you're feeling that way, and I do want to talk to you and hear you out about any ideas you may have for us to make some improvements.
Okay, thank you.
Okay, thank you, Karen.
Sorry, Sue.
No, that's okay. Is there anybody else online for public comment, Christine?
I don't see any hands held.
Okay. All right, let's go to the room then. Yeah,
Okay, so I know you can't respond, but I'll be as efficient as possible. So Patria Marchand, I am the president of Consera Solutions, which is a social impact consulting firm in Davis. And we do a lot of pro bono work in the mental health world. I'm also the former president of Namayola County, and I'm the co-founder of the new, wait for it, Thompson-Williams Mental Health Committee, formerly the Safe Pine Tree Gardens Committee, but has expanded to include support for all housing for adults living with serious mental illness in Yolo County, as well as providing services. I'm here as an individual, and so my testimony is as an individual, but I did want you to know that I am commenting with that experience in the community. So first of all, I just wanted to comment on Ian Evans' presentation, and I wanted to thank him for putting together that information on the continuum of care. I think that is the first time in my over a decade of following these issues in Yolo County that I've seen so much comprehensive information in one place. I think it's very valuable, so thank you, Ian, for that. I also wanted to note, and this is going to be a part of my comment about the action that the Board of Supervisors took yesterday, that there is my understanding, 5.8 million total for housing interventions. 1.4 million of that was actually transferred to behavioral health services and support, so away from housing, even though the Behavioral Health Services Act is supposed to be focusing on housing. There's $4.4 million left. Of that, I think 1.1 million is available for capital expenditures, but there is no information currently in the Board of Supervisors packet about what the other 3.3 million is going to be spent on. And that's going to be, that's just an example that's going to lead into my other comments that come next. I do have a couple of questions to address what happened during the discussion. The first is, in my experience, there has been a need for 2 studies related to housing interventions for over a decade. The first is that question that one of you asked, what is the gap? What is the need? What type of housing? There was actually a 2017 study funded with the Mental Health Services Act that recommended that we do another study to identify what exactly is the housing that we need for the residents that are currently here, and also to bring home residents from other counties who are living with a serious mental illness away from their friends and family. So my question is, which I know you can't respond to, is can you use either some of the housing intervention funds or the one-time funds that are in the fund balance to fund a study that will answer this question, so we actually have data versus having to guess at what types of housing is needed for people living with serious mental illness? The second is it possible to spend some of these housing interventions funds or the fund balance on a study that will actually measure whether these new positions at permanently supported housing will have the intended effect of benefiting those residents, or is it something more than staffing that's needed to help those residents? So those are questions. Again, I'll just repeat it. Can you use the fund balance or the existing housing intervention funding to pay for 2 studies? One, which is what is the type of housing that is needed to bring residents home from other counties and provide housing for people living with serious mental illness in Yolo County who don't have it? And the second is, can you use that funding to do a study of the benefits of adding these additional positions? You do have this great situation of a before and after right now, which is a nice time to do a study. Okay, that's on housing. I will be brief because this is an element in your report that I would like to comment on. I was just made aware on Friday when the Board of Supervisors packet came out that they were proposing to the Board of Supervisors to ask them to approve all of the funding for the 26-27 Behavioral Health Services Act on Friday. That is after significant community engagement meetings, all of which I attended, and which ended up releasing a 4-page summary that did not reflect the input that was provided at the community engagement meetings. The draft plan is not out. The funding has been approved. What was discussed is my understanding. I went to the Board of Supervisors presentation yesterday. I was shocked, honestly. I have a lot of respect for Tony and a lot of respect for Monica. I was shocked. There's a distribution list. There's people who attended these meetings, that there was not an opportunity to comment on what is in the staff report. And even what is in the staff report is just the numbers. There's no idea what these are actually being spent on. And that to me seems to me a violation of the public trust that we have in Yolo County to partner between the community and HHSA on these programs. My understanding is, and I haven't gone to your meetings, that the local mental health board also hasn't been asked for input on these numbers or on the plan yet because it has not been released to the public. So I am just asking now, as someone who has in the past worked with the county to save homes for people living with mental illness, who has raised money in the county for this purpose, I just ask that we restore that sense of partnership and transparency going forward. And the question I have for this item, which is, I can't remember the exact item, it's B, Behavioral Health Services Act on your report. The question I have that you can hopefully answer during your discussion is, what are the opportunities to A, learn what this money is going to be spent on, and B, make changes if the community has suggestions or if the local mental health board has suggestions on what should be changed.
Any more public comment? Public comment? Oh, go ahead.
Thank you. My name is Diane Borders, and first of all, I just want to say thank you to Ian. Thank you on behalf of the Yolo County Housing Authority, and also Tony, your comments. And as a member of this community, I do reside in Davis. I'm the mother of a young man who lives with serious mental health challenges and resides at Pine Tree Gardens. I want to say thank you to the board as well for your commitment to a very serious issue. I have a lot of respect for the way Yolo County has approached this crisis. As everybody knows, it's not just here in this county or this state. It's a nationwide issue, lack of funding for people who live with mental health challenges, substance abuse challenges, and just people who are homeless. I live very close to the Davis Co-op, and I cannot tell you, and I run every morning, and I cannot tell you how many individuals, how often I see people who live, near the tracks there. I want to call the police, but I don't want to call because they're in trouble. I want to have we need resources so that we can reach out to the residents who are unhoused in winter, just in summer, when we treat human beings worse than we treat animals. And it just hurts me to my core. 2 weeks ago, I did have to call law enforcement because there was a lady dancing on the railroad track. And when I called him, the call is she's unhoused, she's clearly mentally unstable, and this is very dangerous. So, we're talking about people who have already are part of this system and maybe are in some of these residences, but we also have a number of people I'm not even sure are on the radar. Do we even have an accurate count of people who are trying to survive in Yolo County? Just trying to survive. They're cooking, like I'll run and they're starting fires up under the brush there at Sweetbriar, trying to cook a meal or maybe get their hands warm. And, if we have a serious issue in this county, again, we have a serious issue in Sacramento. But, these are people who live here for a reason. They probably grew up here. They're familiar with with Davis, within Yolo County. And this is where they feel safe, but they're not safe if they're on the street. So I really, again, I appreciate the effort and all the energy and any funding that you guys can see fit to set aside program for housing and getting human beings our fellow citizens, our family members who did not ask for this, to get them off the streets and get them the treatment and housing and dignity and respect that they deserve. Thank you.
Thank you very much. Would anybody else like to speak? Okay, thank you. So we're moving on to the Behavioral Health Director's report. Members, which letters are we addressing? Oh, yeah, yeah. Also B. So anybody else? Okay, so we've got B, F, and H.
B, F, and H.
We're asking questions, correct?
Oh, sorry, Meg. Did
No,
you
no,
have
but
any?
we're asking questions of Tony, correct?
Oh, you're right. Thank you.
Yes.
Now
Thank
that I said B, I have to remember how to, you took notes, right?
Took notes, what do you mean?
When the public comment.
Yeah,
Our little
so-
workaround isn't working
yeah,
so
no,
well.
I get it, okay. So, I mean, would it be helpful if I just gave like a brief overview first, or?
Okay, thank you.
Okay.
Yeah, maybe talk about like some of the questions about public comments to the plan and this board's comments to the plan and input and changes. Because I know everything moves fast because of these state deadlines.
Understood. So thank you. So the Behavioral Health Service, our first integrated plan draft is due March 31st. And, you know, I sincerely regret that we have not had as much of an opportunity to engage the community as we would have liked to. And this is due in large part to the fact of the delays that we experienced last year with getting the Mental Health Services Act plan, and it delayed the start of this process. What I can tell you is that we are responsible for submitting the draft plan to the Department of Healthcare Services on March 31st. And it's our intention to release the plan for public comment and at the same time as we send the draft to the HCS. It's just a different process than we ever had with MHSA, right? Where we have there's no exception, right? Where, for example, with the MHSA plan last year, it didn't even get approved until like October. It just got pushed out now, right? And there was all of this very public kind of process with going back and forth, right? We have to have a draft to DHS on March 31st. It does not mean that that's the final plan, right? It definitely does not mean that there would not be an opportunity for public comment or for the board to provide us feedback. The HCS will definitely be providing us feedback. But ultimately, we will take that feedback and integrate it into the plan that we do bring back to the board to be approved on June 30th. My understanding from previous MHSA legislation, I don't believe that this change with BHSA, is that after the 30-day public comment period, we would have a public hearing here with the Behavioral Health Board, and then that's additional opportunity to receive feedback from us. Our process, we're definitely learning lessons every year as we go along, and it can be incredibly challenging to get it right, because when we went to the board yesterday, the reason we went to the board was to get direction from the board, right, about what at a grand level, what was the direction the board wanted us to take around the utilization of fund balance. So we have $1.1 million deficit in Behavioral Health Services Act expenditures, right? And without kind of getting into all the weeds about last year and, $26 million of expenses and $15 million, all of that business, right? We basically, bottom line is we have a $1.1 million structural deficit. We also have $3 million of deficits in other funding sources. And we wanted to present the board with all of this information and say, okay, what is it you would have us do? We gave them 3 options. One was a very, very conservative approach, right? That they would have basically expended no fund balance, would have corrected the structural deficit in PHSA funding by moving the money from the housing to a different area, a different component of the plan. But it would not have addressed the $3 million of deficits that we had in other funding. But it would have been the most conservative plan in terms of like preserving fund balance for the future. And there were a couple of other recommendations around the utilization of fund balance. But it wasn't intended to be it was never intended to be this is the plan, right? It was intended to be for the board to tell us either we're approving your use of the fund balance or we're prohibiting it, right? We couldn't develop a draft plan without having that direction from the board, right? Like, so if the board were not to approve us for using the fund balance, the plan's gonna look a lot different than what they do, right? And so that is what we were seeking direction from the board yesterday. I realized that there is, a desire from people in the community to have maybe a more transparent process around that, right? But then there is also some pragmatic political type of concerns. Right? So I'll be transparent about this. We had some conversations with our housing partners last week, right? And it was like, what is in that? What are you proposing to tell the board when you go to the board next week? And we're like, we're not telling you, right? And that didn't feel good, right? But part of it is we had conversations set up with the individual board members to get their input before the board meeting, right? And politically, as a county staff employee, right, I'm not inclined to have information come back to a board member, right? And it's like, why am I finding out about this not first, right? As of and my perception and my experience with working with this board is that they want to be informed first, right? And so that is part of the challenge of trying to work through some of this. So, again, this was never intended to be a slight to the community. This is not intended to be a lack of transparency. I believe I've been pretty transparent, since I've become the director, right, to the degree that I'm able. But really, the intent was to go to the board, get direction about what kind of funding we could use, and then to develop a plan. I'm certainly more than willing to have individual or public conversations with anybody about what we should do from here, but it's going to have to happen quickly because we have to have the plan put together in the next 3 weeks.
Any questions or comments on that from board members?
So when you say it's a draft, you're saying just that we can make wholesale changes to it based on feedback and,
I mean, hypothetically, I suppose you could. I mean, what I will say is that the requirements of submitting the plan for BHSA are just much greater than the NHSA plan ever was.
We're gonna have public comment.
That you will definitely
here on the draft plan that you published on the 31st, probably in the May meeting then?
That's my question, right? Because what you just said was you have a deadline of the 31st, right?
Correct.
Okay. And there's a 30-day feedback period, correct? Okay, so and our 2 meetings are in the beginning of April and the beginning of May. So the one at the beginning of May would be after the 30-day feedback period. And the one in April would be just after you handed over the information. Is that kind of what I'm hearing too?
I would defer to the will of the board about how to approach it, right? I know that in the past, we've set up like special meetings for the public hearing, right? And so if the board wants to adhere to the strict schedule that's been established, that could create some challenges, right? But I would likely request to have a special meeting, right, in order to expedite the process of receiving the feedback and having the public hearing.
Do we have a motion?
Do we have a time frame for when you want that meeting?
Not yet, but
Okay.
I mean, that's,
Does it just
I
make
would
sense to do
anticipate, I would anticipate likely the first week of May would be ideal.
So the first week of May would be, but the first week of May, you just said was outside the 30 days. Are you bound? Can you extend the 30-day period of comment?
Well, no, we don't have, we just have to allow 30 days before we have the public hearing. So we don't have to have the public hearing on the 30th day, right? So it can be more than 30 days out from the time. But we have to accept feedback for 30 days, right? And then we have to come to the Behavioral Health Board and say, this is the feedback we've received and have a public hearing.
And you could receive the feedback via email, right? You don't have to convene in person to meet the 30-day reporting period for anybody to comment, right?
Anyone from the community can comment, and I believe we can receive the feedback from email, from written correspondence, I think that there's multiple ways. And it's not limited to the board members, it's like limited to anybody in the community that wishes to provide feedback.
I think
So then I'm gonna make sure I get this correct. We would submit the draft plan, we'd open it up for a 30-day public comment period. We'd allow 30 days to go by, we would receive all of the feedback, and then we would compile that feedback, make sure that this board has that information, and then there's a public hearing where we receive additional feedback from the board, right? And so we would receive public feedback from this board, feedback from the Department of Healthcare Services, and I have every reason to believe we'll receive feedback from our Yolo County Board of Supervisors, right? And then we would be responsible for integrating all of that into a revised plan that would then be presented to the Board of Supervisors for approval.
I guess I'm not following why we need a special meeting. It sounds like the timing is gonna work out so that our May meeting is the right
Okay,
time.
yeah.
We don't need.
Okay,
Yeah.
right, I think we'll be okay then.
If anyone wants to make public comment to this board, the May meeting would be the meeting to do that on for that plan.
They could either provide public or they could either provide comment to the agency directly, right? But we're required to have a public hearing, right? Where it's like discussion about the feedback that's been received and your opportunity to ask probably a lot of questions about that. Yeah.
But are you planning on having, I'm looking for the date of that meeting.
May 6th.
Are you planning on having the public comments put together so they'll be presented to us? Because, so that meeting it's actually May 6th.
Is that too late?
No, it's not too late, but is it too
I think
soon?
the question is like,
Because
would we be able to compile all of
right,
that?
you will have like 5 days or
So
6 days to compile it.
What we've done in years past is we have a couple of NHSA coordinators, DHSA coordinators now, and they monitor the feedback that they're receiving throughout the month, right? So they're not doing it all at once.
Okay.
So I don't anticipate that part's going to be a challenge.
You usually don't get all
We
that much
usually
feedback.
don't get an overwhelming amount of feedback. Like normally there is a few pieces of very compelling feedback that we'll receive, right? And I certainly don't want to minimize or discourage any of it.
Right.
It hasn't been like last year, there wasn't an overwhelming amount of feedback.
Right.
It sounds like you're done with item B.
Well, let me make sure I got to everything. Yeah, I think I did. If I didn't, someone can comment me outside.
What was your question?
So I've been following, sorry, Tony. Just so everyone who hasn't read the governor's feedback on the CARE Act And I was disappointed, but honestly, not surprised to see that Yolo County was one of 10, I believe, maybe 9 counties named by the governor. 10, where, I don't know if this is like an idle threat, but of him reducing our funding for the CARE Act because our numbers are so low.
Yeah.
And I've always, since we've had the CARE Act, and I'll say this about Laura's Law too, I feel like this county really underutilizes those 2 tools that can be useful. Personally, the CARE Act, they took away a lot of the stick in the CARE Act, so it's not quite as good as it was when originally written. As passed, it's not quite as good as it was. But I've always thought the numbers were really, really, really low, but I didn't know how they compared to other counties. And it turns out it doesn't compare very well to other counties across the state for whatever reason. I don't know why. And one of the things I've always thought about that maybe you want to comment on, and I've talked about this at these meetings, is does our community, are they educated? Are they aware of this tool? And do we make it easy on them to make these referrals, or do we make it difficult? And I don't know the answer to either of those questions, but what I really wonder is why our numbers relative to, population are low according to the governor compared to the other 48 counties that weren't named.
Okay. There's a lot to unpack there, right? And so what Jonathan's alluding to is that the governor had had a press conference and released some data day before yesterday, and essentially had identified several counties as being like these kind of star performers for the CARE Act, and 10 counties as being underperforming, right? Was quote unquote underperforming, right? And Yolo County was identified as one of those counties, so it was underperforming. What I can say about that is that this metric that the governor created is made up, right? There is no performance standard as part of the legislation, right? There was no expectation put upon the counties that you need to perform at a certain level, and we're going to call you out publicly. But it is what it is. What I can say about this is that, my staff has been taking a look at the data that the state's reporting and comparing it to our data, and believes that there's been a bit of an error. And actually, it's enough of an error that would put us just above the threshold of what the performing counties would be. But beyond that, right? I hear what you're saying, Jonathan, about is this a resource that members of the community can access, right? And for whatever it is worth, I believe that we've done what we can to make it available, right? I know that literally the entire time I've been behavioral health director, we've included this information in every behavioral health director's report, just as making sure that the community is aware of how to access this. Part of the challenge, I think, to what you are saying is around the teeth, right? And where
that's not your issue, and that has nothing to do with referrals.
What I'm getting after is that there have been some situations that I'm aware of, at least, where because it's voluntary in nature, the court kind of makes their own decisions about whether or not to have the cases be open or not, right?
But the governor is talking about, tell me if I'm wrong,
petitions,
referrals, not what happens, because that's a whole nother can of worms, what happens after the referral, which I'm not real happy with from what I see. But I think he's talking about just referrals.
Yeah, he's talking about petitions specifically, right?
Petitions.
And so the metric that he's talking about is petitions, and we're not 100% sure that metric is correct, but there's also just quote unquote referrals that never actually lead to petitions. Mm-hmm. And my understanding from talking to our staff is that there are times we'll receive a referral, we'll be exploring a petition, and then we connect the individual to services through another route, right? And so then you get into this, the dilemma of do we file a petition for someone that actually did get connected to services, right? Is it necessary to file a petition? And then are we filing a petition just to meet some metric, right? You know, so, I mean, it's something we're gonna be taking a closer look at, obviously, you know, now that we're in the, I wouldn't call it the limelight, maybe it's like the limelight, you know? But
Families and community members can file a petition as well. So like talking about training, I mean, we probably do need to have some type of training in our community so that people are aware of that process. I know if you go to our website, the Yolo County website, you can find that information. But again, you'd have to be somebody who's kind of informed about it. I don't really hear much about CarePort in the community. You know, my lived experience with my loved one, you know, there was a referral made. I was the one that did it, and it was very difficult for me to complete the process because of our process, and that's supposed to have worked its way out. So I don't know if it has worked its way out. Is it still difficult, or is it easier for people? But I just feel like more people in the community should be aware that they can also file a petition.
Well, I appreciate that. And so here's what I would suggest. First of all, we'd be open to receiving any kind of feedback from this board around ways that we can better promote the CARE Act to the community so that individuals out there who may be interested in filing a petition are aware that they can. And then secondly, what I would propose to do is, if it makes sense, that we could have staff come next month and maybe provide some updated information about whether or not we've worked out the bugs. Because as I recall, early on, there was a lot to kind of sort of figure out, right? And I think we probably have a better process, but I want to make sure we have the right people in the room.
Thank you.
Meg has offered a question in the chat.
Okay.
And it says, this question is for Lou or Diane from NAMI. Do they share about CarePort in their classes for families or CARE Act?
So yeah, I do also facilitate the NAMI family support groups. And no, no, I haven't been. And to be quite honest, I don't have a lot of information on it. So I am going to go to the website. You know, I facilitate with Leona Satterberg, and neither of us, we discuss and share referrals for NAMI supports and services. But, and then I do also share referrals for Yolo County Behavioral Health, as a lot of the parents are seeking mental health services, treatment programs. But the CARE Act is not something that I have been sharing, and I need to learn more about it.
I can connect you with the appropriate person.
All right, that would be great.
Okay.
Thanks, Diane.
So next item?
She said thanks.
Oh, sorry. Jonathan, did I adequately address your question?
Yes, I guess so.
Okay.
So on SB 43, you said there have been 3 instances of the Yolo County resident being assessed as being gravely disabled. So out of those 3, none of them resulted in LPS conservatorship. Does that mean they were denied, or they're still in the process of going through, you know?
I can't speak to that specifically, right? I'm just reporting information that has been given to me by my team and by the public guardian, right?
Where's your fact checker?
Who's my fact? I don't I will make a note that next month that we would like to receive some information about whether or not any individuals who were assessed as being gravely disabled are kind of still in that process, right?
And maybe why each of those 3, you know, obviously we're not getting into names, we're just in general, why is it that they're not being?
What happened?
Yeah.
Okay.
But with that criteria, you could have it clear up in a period of time, potentially. I'm just kind of curious.
I mean, I think that it's
piggybacking on that. And
let me, Jonathan, I think it's a fair question. Let me check with my team and Public Guardian, trying to get a better understanding. I think that the main thing here is that we want to, try to be as transparent we can about some of these things and trying to keep the board updated about progress of some of this stuff. I know the board asked for data, and I'm increasingly asking my team for data around the topics that you're interested in. So getting this kind of, direction and clarity about kind of honing down into some of the more specific details is helpful.
But sorry, Tony, I understand the small n and your sensitivity, so I think we support that. So what you come back with, I think, after you discuss with your staff.
Yeah. I think it's a fair question, right?
Yeah, but
this board has had a lot of interest in SB 43 over the past couple of years. Thank you, Meg.
I had a quick comment and maybe just kind of piggybacking on Jonathan's comment about, and something that he said, and I think is still important, at least since I've been on the board, is where we've really tried to strengthen our communication channels to the community, and what ideas and suggestions does this particular body have in order to kind of get the message out and support HHS staff in that effort. And I know when Christy was with us, that was personally a passion of hers, and I don't want to put Michelle as our newest board member on the spot, but just recalling her background and really being in the mental health space and having a decorated work history in this space. As someone who's newer to maybe being in close proximity to this population, something that's lost on me that I would like to get better at is better understanding how does this population receive messages? And what are the current barriers in which we're currently attempting to message our behavioral health services and the tools and the resources? And sorry, I forget your name. But similarly to the comment you made, as far as we invest a lot of sweat equity and ideas, but we're not really attaching something tangible that further educates and informs us on how we should be intentionally reaching the population. And for some of us that are serving in a volunteer capacity that may not have the lived experience or close proximity to a loved one or be adjacent to this space. I mean, I work in the correctional system, and so I'm close to an underserved population that also too needs these types of services. And so while my focus is in communication, being surrounded by all these experts, what I haven't heard is intentionality behind or further support to Tony and his team as far as like what do the gaps in the current communication structure and setup and efforts are lacking. We just keep saying we need to do more. And then we get the people that show up and, air their grievances, which we need that too, right? In order to get better at what we're doing. And so I don't want to take up a lot of airtime, but I would say maybe we put a pin in this. And if we do have a good resource now, like Michelle, I'd be happy to, spin off and do an ad hoc committee to where maybe we can invest in that. But I just think that that's something that continues to come up. And I've historically been keen on taking action instead of kind of regurgitating some of the same Achilles heels. And so I'll just leave that there for the notes, and then maybe we can revisit it at a later date.
And then if I could just say, certainly we might have some feedback for you, Tony, but you've got these 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 counties: Alameda, Humboldt, Imperial, Marin, Merced, Napa, San Mateo, Santa Barbara, and Sutter, and Tuolumne that he highlighted. And I don't know, maybe they have some ideas about marketing and getting the message out. Maybe that's why they're doing better. Maybe it's just like you can't explain why, but maybe your staff should be reaching out to them to see if they're doing something or have some ideas that we don't. Or maybe this is something that CBHDA, your association for behavioral health directors, should be like talking to all their behavioral health directors about, or maybe having some sort of teach-in or something with the ones that are doing well and how they're doing well, and I'm just ideas.
Yeah, I can tell you, so today, CBHDA had their kind of like lobby day, right? So I was in the state capitol this morning, and we were talking to the different legislators around some of the priority topics for CBHC, which included like impacts of HR1, mobile crisis response being a required benefit versus what's being proposed in the governor's budget as it being an optional benefit. And this topic did come up, right? You know, so it's definitely on CBHCA's radar about how to properly address this. And so I anticipate that we'll be potentially receiving some type of similar guidance to that in the near future.
Okay, I need to ask a procedural question. We're after 8 o'clock and we still have the ad hoc committee reports and public comment to go. Do we need a motion to continue the meeting?
No.
We just go over. Okay. All right. Okay. All right, let's move on to the ad hoc committee reports then. The site visit planning ad hoc committee.
Sorry, hey, Sue, are you good with creating an ad hoc committee for D? If D is still willing to do that, an ad hoc committee that would reach out and come up with, yeah.
Okay, sure. Who wants to be on the ad hoc committee?
So the site visits, we already have an ad hoc. We already have a committee.
I think she's talking about mental health promotion or something like that.
Oh, sorry, the communication committee. I'm sorry, we jumped it. We went to yours and this is going back.
Communication specifically around the CARE Act, right?
Was that what you had in mind, or were you thinking communication in general?
I think the way we originally had it titled prior was communication and education, I think, was it? Communication and education, but centered around all things behavioral health services and like resources and tools. So that would be one prong of maybe some of the other topics that are routinely brought up here that folks feel are lacking out in the community, but we're having robust dialogue here. I don't know, Michelle, if we want to invite Michelle to maybe consider like serving as a subject matter expert. She doesn't have to necessarily do it.
Michelle, what did you want to say?
I don't know that I would consider myself a subject matter expert, but I have a very strong interest from some of the things that I happened to hear as I was on the League of Women Voters Committee that looked at mental health services in Yolo County. One of the areas that we identified as being an opportunity for improving services to the community was improving communication of what those services are. That's something we heard over and over again, where it was very difficult for community residents and families to know what services were available to them and how to access those services. So it is something I'm interested in. I'm hardly an expert in it. I'm learning, but I'd be very happy to serve on that subcommittee.
Thank you. Okay, so we've got Dee, Moises, Kimberly, and Michelle, and Chris. We probably don't want to get bigger than that.
Yeah.
And you've got all those names, right, Kristen?
Yes, I do.
Okay, thank you. So getting back to our current ad hoc committees, back to you, Molly. Sorry about that.
We don't have to make any motions or anything for that ad hoc.
No, because ad hocs can be appointed by the chair.
Okay. Okay, so we finally have a date. We're gonna go out, March 20th at 10 a.m. We're gonna be going to Safe Harbor and do our first site visit. It's not gonna be their first site visit, but with our new procedure that we presented back in October, we're gonna go out and try to see how it goes. So it's gonna be Dee, myself, and Chris. And then we'll bring a report back probably in May, a month after the visit. So that's about it.
Okay. Great work, Melanie. I think you've been doing a really good job leading that effort.
Thank you.
Okay, moving on to the annual report ad hoc committee.
Okay, so everyone has in front of them the annual report draft. So this was completed last week by the annual report committee, and I think you sent it out this last Friday for people to be able to review this prior to the meeting. I want to highlight like a couple things in here. So with a lot of this seems like a very thick document, but I'm just going to kind of try to provide a brief, like high level overview. With a lot of this,
it's kind of more fact reporting. So for example, the goals and accomplishments section is really just us going back through the agendas and looking at the template that Cal BHBC provided, and then filling in that template with things that the board accomplished over the last fiscal year, just by going through the agendas. What I guess is a more subjective part of the report is the key concerns and recommendations on page 3. And if we recall from last meeting, I did a really high level overview on what the topics would be. So essentially expanding data sharing and accountability, maintaining and strengthening services for vulnerable populations, continuing development of the crisis continuum, protecting the county's progress in children's mental health services, strengthening coordination with community partners, continuing to develop supports for individuals experiencing homelessness, and emphasizing workforce sustainability and retention. And then this was developed like in coordination with the whole annual report committee, and we essentially like reviewed the minutes and meeting topics over the last year and looked at public comment, looked at topics that kept coming up to try and decide like what to put. And I welcome any feedback now on like any part of this report, but ideally we were wanting to get this approved sooner rather than later, because this has been a quite long time in the making.
Okay, let's start with Chris.
Yeah, on page 6, there's an error. The MAP program has been in existence since around 2019. It wasn't initiated 2024. It's more that it exists in the jail. I think is an important thing. Now that we're the behavioral health board as opposed to the mental health board.
Okay, can you phrase your edit to the MAP program in a way that Christina can put in the minutes?
You're on page 6?
Yes, under county jail.
Okay.
Yeah, one way to address that would just be to delete that sentence, which might be the easiest.
Okay.
Since it's not a new program.
Okay, so we're deleting the sentence that starts with the jail also launched underneath county jail on page 6.
Yes.
Correct? Okay.
Yes.
I just wanted to say you guys did a really good job. Took me like an hour and a half to go through it today. This may seem like not a big deal, but when I was reading it, pages 12, I think, through 15, there's a lot of areas where there's just like bolded words. I would take out the bolded words here and there, like wellness centers. Yeah, in some of the paragraphs. Actually, back to page 11.
Okay.
As you're reading it, every now and then you're seeing some bolded stuff, bringing your attention to that. And I just think maybe you don't use that there.
Yeah, that was just kind of like a formatting decision, but
Yeah.
like
I was like, okay, what's the bullet? I gotta know the bullet area. What is it? What's happening? It really wasn't any much more significant than the rest of the information. Okay. Excellent, though. That's a lot of work.
No, I just.
Oh, I thought you were making it. It sounded like you were about to say something.
okay, any other edits?
Oh, come on, there have got to be more edits than that. This thing's long.
Yeah, so, and I'm sorry, I should have seen this earlier, collaborative reports, there's some misstatements in that section, and I'm wondering.
So we're on page 6.
Yeah, I'm wondering if you would like me to try to do that here or sort of rewrite it?
I think we should probably try and do it
Oh,
in
because
the
you need to vote.
room. Well, yeah, because then we
Okay.
can approve it tonight.
So sorry, hey Sue, sorry, we can't approve it tonight because it's not on the agenda that it says approval may be taken, correct, Christina, from a Brown Act perspective?
All items that are listed on the agenda are considered for action.
They are,
Yeah.
so we don't have to call it out?
Nope.
Thank you.
Yeah. Okay, so I'm trying to figure out how to do this. So I'm going to try to dictate if someone.
So we don't have to-
Or I can, if are there other, is Is this meeting gonna last a few more minutes? Because I can try to just type it out really fast.
Well, the next thing after this is the public comment, so we need to vote before we move.
Okay, so, but are there, maybe the question is,
Do other people have edits?
Edits, yeah.
Wait a minute, so we do have to vote to approve this version?
They're trying to get it to the board,
Do you have edits?
I haven't had a chance to fully go through it, but I was just, based on Meg's comment, it sounded like if it wasn't formally agendized, then we don't necessarily need to act on it tonight, so.
But you could if you wanted.
Oh, okay.
I mean, I'm not correct. Dee, I'm not correct. That's why I was asking for clarification. I apologize. I was missing. Christine is correct.
If I understand the intent of it would be ideal to approve it tonight so that you get to the board.
Right.
I do believe that you could potentially identify the edits that need to be made, and then you have to approve that, right?
Well, yeah, but you would need to tell us what the edits are, right? Yeah. I mean, like, something like remove extraneous bolding, I think we can just put that in the motion, but, yeah.
Is it possible to push us beyond any public comment or the planning we have and then come back and vote on it? To give Jonathan a moment to write?
I don't think we have a lot of time.
Okay.
Right?
Yeah, we're overtime, so you have all the time you want.
But,
We're overtime, so you can.
well, I don't,
I mean, if there's a way you can phrase it so that it is general in the way of removing bolding or something like that, instead of like, it doesn't necessarily have to be word for word.
Yeah.
If you're just making a correction to one statement.
And you don't have to take my suggestion either.
Yeah, I'm open to any.
It's not gonna work.
This is a
collaborative, so, you know,
Sorry.
I didn't get that.
okay, okay, I want to just try to, does someone want to? How do we want to?
Can you
What, are you putting it in the minutes?
Can you sit at that computer and type it?
I
can dictate it.
Okay.
You can say it loud and clear, and the program's going to record you and put you in the transcript.
Okay, I'm going to try this on the fly. In the first quarter of 2025, the Yolo County District Attorney's Office announced termination of certain, these aren't the VA's programs, of certain discretionary diversion programs, including mental health diversion and addiction intervention court, and pause new referrals and agreements for mental health court. The stated rationale was to redirect limited resources toward implementation of the statutorily mandated Proposition 36. The announcement prompted concern among stakeholders given the established role that these programs have played in supporting individuals with behavioral health needs within the justice system, period. Subsequently, the district attorney's office and county partners engaged in further dialogue and agreed to reinstate mental health court. Collaborative efforts are currently underway to resume operations and restore access. Sound right, Chris?
I haven't been a part of that.
Okay. That's right.
Okay.
So, yeah, so I think that more accurately reflects what has occurred.
Okay, so we've got 3 edits to the collaborative courts section. Okay, any other edits to the document? Do I have a motion to approve the annual report with removing the extraneous bolding, with the correction to the county jail section, and the correction to the collaborative courts section?
So moved.
Second.
Okay, all in favor?
Aye.
All opposed?
Meg?
She raised her hand.
Thank you.
Any abstentions?
Can I just say?
Oh, one abstention.
Can I just say what an amazing job these people did on putting this together?
Absolutely.
Kimberly, especially, Meg and Sue and everyone else that worked on it. It's pretty amazing what they did.
Yeah, great. I just can't believe we approved it that quickly.
I wanna recognize, the entire committee's, effort on this. This was many hours on Zoom, many hours of discussion, many hours of trying to format this. So I really appreciate our collective effort in getting this done.
And I really appreciate your leadership in that, Kimberly. The enormous amount of time you put into this. Thank you.
Yes, collaborative effort.
Talk about carrying the ball across the finish line. Good job.
Yes, yeah.
The other thing I was going to try to bring up is, I guess what context should we try to share this with relevant parties?
When we discussed this last week, we're gonna put it into the website, and the location, I would put it onto our website. This has been distributed to our interested parties. Where else would you like it to go?
You mean because it's gonna be distributed again with the edits?
The edits will be updated.
Okay.
I didn't create the link until we got the final draft. So once the final draft's completed, then it will be shared online, and then we can push it back out to the interested parties, and it will be a final draft.
So then
But I'm gonna send it to you first to look at it.
And then on the LBHV section of the county website?
Yes, and it will be on the title page.
Okay.
Yeah.
Okay. And then it needs to go to the board of supervisors.
Well, it'll still be final draft, but the link will be there when I send out the notification, leading everyone back to where it can be found on our webpage, and then how you submit it to the board of supervisors, or you have to get on the agenda for it to be shared. What date were you planning? Have you guys already worked out that process?
I don't know.
Yeah, not specifically.
Okay, so we'll figure that out then.
When were you planning to share this with the board of supervisors? What's your date?
Yeah, I wanted to kind of get feedback on that process and kind of exactly how we're going to be doing that, to be able to communicate this directly.
We can actually do that probably offline.
Okay.
Yeah, so separately, I'll just reach out to you guys. Or reach out to you.
And then Christina, do we have to officially close that ad hoc committee, or?
I think it will be closed once you submit your final report to the board of supervisors. When that's complete, then we'll close the ad hoc.
Okay, thank you.
I mean, you've completed your report, but you still need to present.
Right. Okay. Is there anything else we need to talk about on this item? That's it. That's it. Okay. Moving back to public. Public is left. Is anyone who's still here? Would you like to comment? No. Okay. What about online? Okay. So, future meeting planning and adjournment. Meg, I think you had something for future meeting planning, didn't you?
Yeah, I was going to thank Ian and Tony for their much needed discussion and report out. It was great. And I was wondering if we want a motion to invite Ian back next month to share the data he had discussed. And then that would determine the cadence of continued report out. And then that would allow us to continue the discussion if needed. So
we just missed him.
Yeah, I know.
Yeah.
But that was what I was thinking. Also, there was some other, I guess, topics that came up to like what presentations would we want next month. But I was thinking that this discussion was so great and there was a lot that came out of it. It might be good to continue the momentum. And then, that's if Ian's up for it and has time. So no is a perfectly good answer. If you guys don't want to, that's fine too. It was just a thought.
Do we need a motion or can we just, as the chair, can you just invite him back?
I just was hoping to get feedback from the group and
I see.
That comes down, or they wanted something else,
Okay. Does somebody want to move to bring Ian back next time?
We really will have to check in with Ian to see if he's
Well,
going to
yeah.
be available. To give them an outline of really what we to report as far as the data goes.
We can't drag him in, but.
I mean, I think we want him to share the data that he had, so that we can understand what data is there and then determine the cadence that we would like them to report back out to see if those added positions are working. is really what my thought was. So it might be too soon, but maybe Tony, I'll defer to you to see what you think. Or we can just move on and put something else on the agenda.
It's fine with me. I mean, again, I'll defer to the will of the board, right? You know, but I'm happy to coordinate that with Ian if that's something that the board desires.
Yeah, I'm not seeing a.
Data, I think he was talking about, wasn't that what went poorly once Hope Cooperative stopped engaging and we had a staff deficit, and you're filling that. That's gonna take at least 3 months before you fill and train those positions.
It's gonna take time for that data.
Yeah.
But he already has data. Didn't he speak to, we already have data?
Here's what I can do, Meg, if it's helpful. We'll reach out to Ian and say, to what extent do you have data that you could report on, right? Historical data that might be helpful for the board to get a better understanding about what's going on at these sites. And then kind of go from there. Would that be okay?
Yeah, because it was based on Moises' question, right? He asked about the data, and then I thought I heard him say that he has statistics that might be helpful. Yeah, that would be great if you could validate that. But if, again, the board is okay with just, waiting for 3 or 6 months and then kind of coming back and revisiting, I'm fine with that too.
Okay.
So I'm not hearing a motion, so maybe we just, we don't need to reach out to Ian then. We can just maybe invite him back in 3 or 6 months.
Okay, I will have a conversation with him to let him know about this conversation.
Okay, thanks. Any other topics that the board would like to consider for next month's agenda? Obviously, we have, Tony will be sharing the data on the public, right? We'll be out of our 30-day window. You can share.
That's gonna be for April hearing.
That isn't it next month.
It would be in May. It would be in May.
May. Okay, so you can't really share anything with us next month.
But I will share what I have with you next month. By that point, we should have released the draft plan. We can start having a conversation. There's no reason we can't have a conversation about it. I just think it'll be early on and you may not have had enough time to digest it,
Right.
Yes, I can include some of that. We can have like a high level overview or something like that.
That'd be helpful.
Yeah, that'd be fine.
Okay, and then maybe you could report back on the CARE Act, what we have as far as petitions or whatnot, or maybe what's going.
Yeah, I will include that information.
Yeah, okay.
What prompted the housing presentation? I'm sorry I haven't been able to be here. I'm just trying to figure out how that made.
There was some tangential conversations that have been happening here, related to permanent supportive housing, and especially because the permanent supportive housing partners were experiencing these challenges, and I was trying to be transparent and bring it to the board's attention, and had suggested that it might be helpful for Ian to come and give a presentation. I know as we were having some of the conversations, it was kind of apparent that it might be helpful just for him to come in and do some level setting around that, just so that the board had some kind of like a base of knowledge and background information around that.
Okay. Meg, we have a good track record as a board of when we do have presentations that come before us, such as the legal guardian that manifested to 2 positions for that team. And so we are on an upward trend of being able to kind of voice our considerations, opinions, recommendations that actually manifest into, resources. And so I think maybe if this is something that you're still thinking through when we leave this meeting, is maybe bringing it back to discuss as a board of, is there a certain specific action we want to center our discussion around, and then devise a proposal or recommendation that can then be provided to the Board of Supervisors to act on. But I wasn't hearing anything that, which is why you didn't get a motion from me, or I would have supported you on that. But if we do identify something actionable and that we think that this body can influence the decision makers on, then I say we bring that back and have that discussion. I just didn't hear that today, but
Yes.
The idea.
Yeah, beautifully said, Dee. I wasn't trying to call you guys out. I apologize if it came out that way.
Got your back, Meg. Don't worry about it.
But anyway, yeah, exactly. I'm trying to. We're trying to move forward in bringing presentations so that we can make thoughtful recommendations to the Board of Supervisor and support the programs So yeah, exactly. So if we could do that next month, that would be great. We could have that discussion as a board. I think Tony posed a great question around philosophical question, and it just felt like that really needed more exploring as well. Housing first is wonderful. However, are there other balanced approaches that maybe we could consider? And the data might help determine that. Yeah.
I haven't been here yet to tell you, Meg, but you're doing a great job as our chair, so.
Oh, thank you.
I feel like we're busy, and that's what we need, so thank you.
You're welcome. It's a village, and I can't do it. Jonathan's been a great mentor, and Sue and Kimberly are great drivers, so, and you guys are all amazing, so I appreciate that. Thank you. All right, so sorry, I have a migraine, that's why I'm not there, and my head is half working. Do you have a motion? Can you put that into a motion, Dee? Sorry, or are we pushing that to next month to discuss?
Yeah, I'll just motion that we maintain the housing discussion as a topic for the next agenda, and then also, without putting too much pressure on Tony, but just the deliverable would be a follow-up from Ian, based on the data question that he just posed. And then we can continue to build from that each meeting until we land on something that we think actually deserves presenting to the board of supervisors.
Second.
Yeah.
Okay, what they say, that's great. So between that and Tony's expanded update maybe on that, it sounds like we have enough for presentation. We have a good 2 strong agenda items for next month.
But are you wanting those on time set agenda or just as inclusion on
Time set, please.
On a time set agenda, okay.
Yeah, and Christina, we can work on that. You and I can work on that. Okay.
And I know Chris has been trying to say something.
I think we're looking at how long it takes to get a site visit set up. We probably need to create another ad hoc committee for the next location. I was going to propose the mental health services in the jail as something to see if we could examine. And that would be outside of, we may need to narrow that somewhat because there's a lot there, but just kind of start that discussion. Because I could see that could take some time to organize.
Okay, so we want to ad hoc around the next potential site visit being the jail?
Yes.
Okay. All right, and do you and Melanie want to chair that? Or
Sure.
Melanie, you've done fabulous work. Thank you.
I think that we'll come up with something. Whether it's going to be everything in the jail or just certain aspects of it. There's a lot there.
I have a question, piggybacking on what you're saying. So has there ever been a site visit with the roving outreach team that intercepts people out in public, like in crisis management?
We're just starting up the site visit process again. I think we've had one in 2024, trying to do 4 every year. And so members have a suggestion for what we should do for site visits. I'm not sure if a site visit at some of the other housing places that may need, say Pine Tree Gardens, for example, they need funding for building maintenance or any other of the programs, if that would be helpful for or not. But that sounds like I don't know if it's a site visit or
a ride along,
or I don't know if that's possible with the HIPAA issues.
Yeah, so the site visits are the ones where we have contracts with the county. That's part of our mandate as a board, but it doesn't mean that we couldn't also do tours or ride-alongs. It would just depend if that roving group is actually contracted out from the county, Tony. Then it would fall under site visit, right? If not, it would be more of a tour.
I'll defer to, I'm not even sure, but I don't know that the site visits have to be necessarily part of a contract. Assuming that it does, I suppose you could potentially go with AMR or something like that, because that's a contract provider for a mobile crisis response. But outside of that, I don't see, unless it is a requirement that it be a contract, I think that there is a way we could arrange for some sort of opportunity for you to do like a quote unquote site visit with our crisis co-responders or something like that.
So maybe Chris, you guys could talk about that, this new one, figure out where the next visit is, whether it's to jail, is it AMR? Maybe you push out for the next, that would be great. Those are all great questions.
So the new ad hoc committee is to determine the next site
Yeah.
visit.
Yep.
Yeah, and what those limitations are, and what's included, okay.
Okay, so this isn't, the ad hoc isn't the people visiting the next site, it's the people determining the next.
Correct. And I will tell you, we already created the criteria. We can go back and look. A site visit is basically if we have a contract, because what we're supposed to be doing is making sure that the provider is providing, meeting their contractual obligations. And so that's why it's a site visit versus a tour. If there isn't a contract, it doesn't, the scope might look different. So if you guys want to feather that out, that you could, maybe if you want to parse that out a little bit more, but that's kind of the guardrails we had determined. And yeah.
Just for background, we have a requirement per Welfare and Institutions Code to assess the facilities and the cadence in which we do that. And so I think that's why this committee is specific to just getting us in line with that requirement. And then anything else around that would just be the cherry on top. So long as we meet that metric per statute, and then we can see what those other options look like. I would love to do the broken.
Yeah, perfect. All right.
We adjourn?
I'll motion.
I think we're just adjourning. Thank you, everybody.
Thanks, Sue. Thank you.
Oh, no.